performing general survey. So the goal of our the goal is that the assessment will be completed so that the patient without having a anxiety or discomfort. First is to perform hand hygiene and put on PPE. And then after putting on PPE, we're going to identify the patient. And then, after identifying the patient, close the curtains and the door of the room and explain the health examination. Answer any questions. So, good evening, ma'am. I'm Nurse Sandra. And today we're going to perform or do a general survey. Do you have any questions? And then after that, we're going to proceed to the assessment. So first is we're going to assess the patient's physical appearance. So observe if the patient appears her stated age, and then note her mental status, and also check if she's um, she's oriented, alert, and responsive in questions and responding appropriately. So I'm going to ask a question. So can you please tell me what the date today is? And then don't forget to check the patient's facial symmetry. And then note take note of the of the acute discomfort, shortness of breath, pain, and anxiousness in the patient if appears. And then after that, I'm going to proceed to the assessing the body structure of the patient. So first is we're going to check the patient's weight if it's in the normal range according to her stated age, and also to genetic heritage. Also, the check check the height according to the normally range and based on the stated age of height, and also in the body build. Also check the fat if it's eventually distributed, and then check the patient's posture, erect, if it's appropriate in the age and body. And then after that is we're going to proceed to assess the patient's mobility. We're going to check if the patient is even, and then even, stable, and and can coordinate. Also check the joint mobility with a full range of motion, and then also to take note if there is some involuntary movements. So ma'am, can you follow this range of motion exercise? So flexion, extension, flexion, extension. So the patient is completely have a general or the wide general range of motion. And then after that, we're going to proceed to assess the patient's behavior. So we're going to check if the patient's facial expression is appropriate, and then if the patient can maintain eye contact, and then also check the patient's hygiene and well-being. Also check the patient's clothing if appropriate, and then after that is we're going to assess the pain. So if so ma'am, if you have a if you have feeling pain, can you please tell me on a scale of 1 to 10 how would you rate your pain if you feel one? So there's so there's no sign of pain in the patient. So next is we're going to uh, have the patient remove the shoes or any slippers, and then heavy dresses, and then we're going to check the patient's weight and height. Okay, and then after that is we're using scale with a pole. We're going to assess the patient's weight and height. So, um, we're going to assess the patient's weight and height. So the patient's current so the patient's height is in 172 centimeters, and then the patient's weight previously is 50 kilograms, and now her weight is 52 kilograms. So after that is we're going to compute to check the body mass index of the patient. So we're going to multiply the weight and then divide it by the we're going to multiply the height and then divide it by the weight. So so I already computed it, and the answer is 17.61, which means that the patient is underweight. So and then after that is we're going to measure the patient's waist using tape measure. So we're going to measure the patient's we're going to measure the patient's waist. So the tape measure must be in the umbilical area. So the patient's waist is in 27, and then we're going to take note of it. And then after that is we're going to measure the patient's temperature, pulse, and the pulse, respiratory rate, and then blood pressure. Um, and then after measuring the vital signs of the patient, is we're going to okay, so the patient's temperature is 36.2, and then after doing all the vital signs and after taking note of it, so we're going to remove the PPE, perform hand hygiene, and we could do the assessment as indicated.